Good afternoon. Thank you once again for joining me for the pharmacology class. So in continuation of cytotoxic drug, I will be continuing with Camptothecin analog. Camptothecin analog. Camptothecin analog, I just want you to remember that we have only two drugs coming up here, that is topotecan and irinotecan. Topotecan and irinotecan. Topotecan and irinotecan, they are the semi-synthetic analogues of camptothecin. Semi-synthetic analog of camptothecin. They possess anti-tumor principle. Anti-tumor principle, and these are obtained from Chinese tree. Chinese tree. This is a main source where you get these drugs. Now, I just want you to remember or try to recollect the adipocyte drug which we had dealt in last class. It belongs to adipocyte. Adipocyte belongs to adipophiltoxin, which is a group coming under cytotoxic drug. And we had seen that it will be interfering with the G2 phase by interacting or by having an impact upon the DNA topoisomerase 2 enzyme. And here the formation of double-stranded DNA cleaving will not be interfered, but the resealing of the sealing of the strand will not be encouraged in adipocyte. This was the manner the adipocyte was having or was contributing to the part of anti-cancer property. But when it comes to this particular drug, camptothecin analogues, what they do is they also possess the same manner, but they are not going to have an impact upon DNA topoisomerase 2 enzyme, but they are going to interfere with DNA topoisomerase 1 enzyme. And what it does is it will go and bind to this particular enzyme, and it allows the single strands, the single strands to break in DNA, but it will not interfere with the resealing after the strand has got untwisted. After the strand has got untwisted, it will not be favoring for resealing, and they damage the DNA during the replication phase. The replication phase it will do, and it is going to act in the S phase. There are certain phases in the cell cycle like G1 phase, S phase and all. Now S phase is the phase where the synthesis of DNA will be occurring. So basically this is going to act in the S phase, whereas in adipocyte it will be arresting the cells in G2 phase. That is, G2 phase follows the S phase. So here this will be taking place in the S phase. As a result, the cell cycle will not be interfered, or it will not go or enter into the G2 phase. So this is how this particular enzyme will be this particular mechanism of action will be taking place. So I repeat, what it does is, this particular camptothecin analogues, what they do is they will be just they will not be behaving as a mitotic inhibitor, but what it does is it will go and get bound itself to the enzyme DNA topoisomerase 1. So as a result, it will cause breaks in the single strand of the DNA, and when there is a break in the DNA strand, it will not be interfering with the resealing and all, once the strand gets untwisted. And what happens is the DNA replication will not be taking place. So in simple words, if I say, it will be arresting the cells in the S phase. And I want you to remember, the S phase in a cell cycle means it is a phase, or it is the area, or it is a time where the DNA synthesis will be taking place. And once the S phase gets interfered, or it will be attacking the cells in the S phase, then the G2 phase, which follows the S phase, will not be seed, or the cells will not be entering into the G2 phase. This is how the two drugs will be acting upon the cancer cells. Now we are going to have a look at the individual drugs. First, I will start off with topotecan. Topotecan. Now, this is very useful in case of metastatic carcinoma of ovary, small cell lung cancer after primary chemotherapy has failed. Metastatic ovarian carcinoma as well as in small cell lung cancer once the primary chemotherapy has failed. Major toxicity is bone marrow depression, especially neutropenia. Bone marrow depression, especially the neutrophils, will be getting affected here. Other adverse effects are abdominal pain, vomiting, anorexia and diarrhea. Abdominal pain, vomiting, anorexia and diarrhea. Dose 1.5 mg per meter square intravenously over 30 minutes. 1.5 mg per meter square intravenously over 30 minutes daily for 5 days. At the same time, you have to monitor the patients for these kind of adverse effects, and also make sure that you run a complete blood count. Moving over to irinotecan. Irinotecan. Now, irinotecan is actually a prodrug. Now, what do we mean by a prodrug? It's actually a biologically inactive compound which can be metabolized in the body to produce a drug. So, it is actually biologically inactive form of a particular compound, and this can undergo metabolism in our body in order to produce a drug. So, irinotecan is actually a prodrug, and it undergoes decarboxylation in liver to form into a active metabolite. And here, once this particular drug has been started in the patients, you can find that patients start exhibiting or start showing out cholinergic effects. Okay, cholinergic effects can be noticed in the patient, and this can be suppressed when we do prior atropinization. When we do prior atropinization, this cholinergic effects can be reduced. Indications. When do we go for irinotecan? Metastatic or ovarian colorectal carcinoma, cancer of lung, cervix, ovarian, etc. Dose limiting toxicity is diarrhea. All this while we had seen was bone marrow depression and all those cases. But here the major toxicity you can find is diarrhea, neutropenia, thrombocytopenia, hemorrhage, body ache, weakness. They are the other adverse effects. Now dose 125 mg per meter square intravenously over 90 minutes. That means over 3 hours you have to go weekly for 4 weeks. Okay, it has to be administered weekly for 4 weeks. So this is all about camptothecin drugs. Camptothecin drugs, they are the ones, they belong to cytotoxic drug. Okay, we have two drugs, irinotecan and topotecan. These are semi-synthetic analogues of camptothecin. They possess anti-tumor principle and they are obtained from Chinese tree. If you see the mechanism of action, it is almost similar to etoposide, but it will be interfering with DNA topoisomerase 1 enzyme. Okay, and this will be arresting the cells in the S phase. Okay, it will be arresting the cells in the S phase. Now what it will do is it will be causing breaks to the single strand DNA, but it will not be interfering with the resealing part of the DNA strand once it gets untwisted. but it will be arresting the cells in the S phase and does not allow the cells to enter into the G2 phase. In simple words, if I say the DNA replication will not be allowed to take place over here. Now moving over to the first drug, Camptothecin. Camptothecin, it can be used in metastatic carcinoma of ovary, small cell lung cancer after the primary chemotherapy has failed. Major toxicity is bone marrow depression, especially neutropenia. The other adverse effects you can find is abdominal pain, vomiting, diarrhea, and anorexia. The dose which we need to administer is 1.5 mg per meter square intravenously over 30 minutes, minimum daily for 5 days. Okay, for 5 days. Irinotecan, it is a prodrug. It can be decarboxylated in the liver into an active metabolite, and it produces cholinergic effects in the patients which can be suppressed by prior atropinization. By prior atropinization, we can go for stopping this cholinergic effects. Now the dose limiting toxicity which we can find in this particular drug is diarrhea, neutropenia, thrombocytopenia, hemorrhage, body ache, weaknesses. These are the other adverse effects. Dose is 125 mg per meter square intravenously over 90 minutes weekly for 4 weeks. So with this, I have completed, or I have covered, Camptothecin analogues. Thank you.